Hello and welcome to this episode of Happy Birthday Wellness Quiz Day 176, your health promotion and disease prevention podcast brought to you by Kiki Afya. My name is Subiri Obubu, a medical doctor and specialist in public health medicine. In today's episode, I'll be discussing 6 differences between type 1 and type 2 diabetes. Now here is a quiz for which I will share the answer at the end. Different forms of diabetes include A. Type 2 diabetes characterized by inadequate insulin production and diminished insulin action. B. Type 1 diabetes characterized by autoimmune destruction of the insulin-producing cells in the pancreas. C. Other forms such as surgical removal, injury to insulin-producing cells in the pancreas, and genetic mutations. And D. All of the above. Diabetes affects the way our cells use sugar or glucose. The food that we eat turns into sugar in blood, and the sugar needs to get into cells, and that's the work of insulin, which is produced by the pancreas. So in most cases, either the pancreas doesn't produce enough insulin, or it cannot effectively use the insulin that is produced. Diabetes is a worldwide epidemic. It's increasing rapidly, mostly in Asia, Africa, and South America. The World Health Organization estimates that 37 million people worldwide will have diabetes, 80% of whom will be in low and middle income countries, and deaths will double by 2030. So this is a very important public health problem. Now, diabetes has long-term consequences if the blood sugar is not controlled. That's mainly damage of nerves and blood vessels. This can lead to blindness, limb amputations, kidney failure, and sudden death. There are 2 common types of diabetes, type 1 and type 2, which we'll be discussing in this episode. So what's the difference between type 1 and type 2 diabetes? Type 2 diabetes is the most common form of diabetes. It tends to run in families and accounts for approximately 85% of all cases worldwide. About 85% of individuals diagnosed with type 2 diabetes will have a close family member with the disease. So remember, if you have a close family member, parent, sibling, brother, sister with type 2 diabetes, you are likely to be at increased risk, and it's good to be screened for the same. Now, in type 1 diabetes, 90% of people who get type 1 diabetes do not have a relative with the condition. The causes of diabetes mellitus range from body's immune system attacking the insulin-producing cells to a combination of inadequate insulin production and tissue resistance to action of insulin, or even injury to the pancreas and other multiple causes. Now, type 1 diabetes is most frequently diagnosed in individuals of Caucasian ancestry. However, it can occur in any population. Type 1 diabetes is most frequently diagnosed in younger individuals. However, remember, it can develop in any age group. With the increase in childhood obesity, we are now beginning to see type 2 diabetes in younger children. Type 1 diabetes also requires treatment with insulin, whereas type 2 can be treated with insulin, tablets, diet, as well as exercise. So briefly on diagnosis for type 1 diabetes is the same. Historically, fasting plasma glucose, or what we call 2-hour value of glucose following ingestion of 75 milligrams of glucose, were used to diagnose diabetes and prediabetes. However, in 2009, an international expert committee recommended the use of HbA1c, or what we call glycosylated hemoglobin A1c, with a threshold of 5.7 to 6.4, what you have here for prediabetes, and above 6.5 to be diagnostic of diabetes. A1c basically refers to the stickiness of the red blood cells. If the red blood cells are floating in a sugar environment, then the A1c tends to be high. Specifically, diabetes is diagnosed also if you have a before breakfast or fasting plasma glucose of 126 milligrams per deciliter, what you have here, or plasma glucose of more than 200 milligrams per deciliter or higher after this oral glucose tolerance test, what you have here. So all these tests, remember, should be confirmed on a second day. So don't just rely on one test. So back to our quiz. The question was asking us different forms of diabetes, and all the answers are correct. So that A is type 1, type 2, but there are also other forms indicated therein. So thank you very much for listening. This podcast was brought to you by Kike Afya. My name is Biri Obogo. I'm a medical doctor and specialist in public health medicine. We rely on well-wishers to bring you this content, and you can support us by commenting, sharing, as well as subscribing to my YouTube channel. You can also support us through this M-Pesa till number 766-500 or the mobile number 0720 95 8250, mostly to enable us to reach more people with this message. Until next time, bye-bye.